So, welcome everyone to our June Practice Managers meeting. My name is Selena. I'm on the provider relations side here at AHP. As I've mentioned before, if you could just drop your name and practice in the chat, this is used for attendance and will be credit towards your citizenship reward at the end of the year. So let's start by reviewing today's agenda. So today we are going to just provide some updates, some staff updates here at HP. Then we will have Elizabeth Sharp, our Director of Clinical Operations and Quality Improvement, review some of the 2026 quality measures and performance so far. She is also going to provide some updates on the ACO REACH work that we have going on in the network. Then we are going to hear from Dr. LJ Shipley, our Associate Medical Director for Maternal Child Health, on our SCN program and updates there. We will have time for open discussion. As you can see, it's sort of a lighter agenda this month. We do have a topic of discussion from a practice that we'll get to when we get to that portion of the meeting. So here are a few of our staff updates. So we have welcomed Megan Ziegler as one of our primary care clinical pharmacy specialists. Alexei Leduc is our new care manager. And Ian Brown is our applications administrator. And Giovanna Gilmore is our data coordinator. So we're very happy to have them here at AHP, and you will be seeing them, hearing from them in your practices and in the work that we do together.
I just want to call out really quickly, sorry, Selena, that Ian and Giovanna are really big developments for the provider relations team. As you know, we collect all of your practice data, your locations, your physicians, your APPs across the board. And so these two hires actually will be instrumental in changing the way that we do that, improving the way that we do it for consistency's sake. And so you'll definitely be hearing more from Giovanna going forward. Ian's going to be primarily working in the background, but you may, hear from him from time to time. But those are really, great additions to the team, as are Megan and Alexei.
Thanks, Jana. So we do have a couple of other staff updates. We did say farewell to our colleague, Willie. He retired at the end of May, and he led us through our Health Catalyst project, and he will be greatly missed. Also, Molly Parmiter is on leave for the next couple of months. I will be filling in for her. So if you have questions or updates that you would usually send to Molly, feel free to send them over to me, and I will help try and fill those shoes as best as I can. So now we are going to turn it over to Elizabeth.
Also very impressed. The job title rolled right off the tongue. I don't think Jana can do it that well.
I can't. I can write it out really well, but I cannot.
There's too many words.
Say it.
I was doing my Mimi Momo Moose, Mimi
All right. So to jump in, I'm here today to talk a little bit about the quality measure program and ACO REACH. We will go to the next slide. A few reminders. So wanted to highlight for everyone on the call today that your practice's performance is what the quality incentive is paid on this year. We're going back to what I lovingly refer to as the before times, where we're feeling good about the data. We're not in the midst of a global pandemic, and we can take a look at your practice's actual performance. That practice performance is accessible on the provider engagement report. We did our level best to reach out to every practice late last year, early this year, as folks started getting connected to the Health Catalyst data to offer trainings. That being said, I can only learn a system if I'm the one clicking the buttons, and you can't click the buttons until you've been trained. We are happy to retrain anyone who needs access, who needs a refresher, or who needs support. Please, if you want retrain or if you need to get new users up and running, reach out to Kevin Kelly. He did not know I was putting his name on this slide, but he's a good sport. He can get users set up and offer that training and walkthrough. Next slide. So I popped up here just our overall network performance. I will call out this is year-to-date performance. So the numbers look low. That's not surprising at this point in the year. We are seeing improvement from the previous month, and we have a new tool kind of in the back end this year that is very exciting to those of us who look at these quality measures all the time. We have some trending data available. So we can now look at where we sat last year from a year-to-date perspective. And for example, instead of panicking about the fact that child and adolescent well care visits, for example, is at 26%, which is pretty far away from that 74%, 90th percentile, we can really feel okay about it because we're doing better than we were at this time last year, and we hit the 90th last year. A large number of those gaps are closed in August as kids go back to school. So we're able to kind of look at the cyclical nature of some of these quality measures. And we are engaging with our clinical partners, our data coordination team, and everybody across the network to make sure we're moving the needle. And go to the next slide. A couple of highlights. So that child and adolescent well care visit measure that I just mentioned is on our provider-facing grid this year. We've surfaced this data for folks before, but for those pediatric practices and those in family medicine, this is one of the measures that you are held accountable for this year. It is a very wide age range, and we know that there are different interventions for the 3 to 8, the 8 to 11, the 11 to 18, and the 18 plus. Did I do that right, LJ? And so if additional data is helpful in terms of patient level breakdown, we're happy to provide that, show you how to work within the system to get it yourself, whatever is most useful. Breast cancer screening had a change in HEDIS definition for 2026. So it used to be the denominator was age 50 to 74. Now it is age 40 to 74. I will say clinically, most docs in our area have been recommending a mammogram at age 40 already. We did some analysis on that age 40 to 50, that sort of net new population, and found that 60% of women had already had a mammogram within the appropriate time frame. That's not as high as what we want, but we're not starting from zero. So we are doing a deeper dive into where that net new population is. We may be reaching out to you. We are going to be engaging with our OBs and our payer partners, Excelis, MVP. They're all really focused on this new population as well. We've historically done quite well in breast cancer screening, and we don't want that to change just because we added in a new group of patients. And then some clinical initiatives. So a little bit separate from the quality measures, but impacting your citizenship opportunities. As practices engage in these opportunities, there is a connection to that citizenship component of the incentive plan. The first one I wanted to mention is collaborative care. So collaborative care is an integrated behavioral health model with co-located services, really partnering with the PCP to provide care for conditions like depression and anxiety. We have some practices in the pediatric space that are working under a grant-funded model for collaborative care, and there are pockets around the network in OB, in family medicine, in internal medicine. It's something that our behavioral health integration team is really passionate about. We're continuing to look at additional opportunities, but if this is something of interest, please feel free to reach out to me. We're happy to talk about opportunities in that space. And then the second thing I wanted to call out is smart therapy training, but Bob Adams is on the line and has graciously agreed to speak to that. So Bob, I'll hand it over to you.
Sure, yeah. So smart therapy or asthma therapy is one of our community-wide initiatives. So if this is something you're interested in, Paul Tremblay and myself would be happy to come out to your practice, talk a little presentation. We usually go over the GINA guidelines and what's been changing year to year, talk about Symbicort and Breyna and smart therapy, single maintenance and reliever therapy for asthma treatment for pediatric and adult patients. And if there's something you're interested, just feel free to reach out to us, and we'll be happy to come out and get on your calendar.
Thanks, Bob. Does anybody have any questions about quality before I start talking about ACO REACH? Okay. Thanks, Selena. If you don't mind going to the next slide. So ACO REACH, I just wanted to bring this up here. I'm sure some of you have heard about this, some probably haven't. But the ACO REACH is a new contract that AHP has for 2026. I will note it's a new population under contract. These are not new patients under care. So this population has been in our network since we started. We just had the opportunity to pull them into a contract, and we decided to take advantage of that. We are partnering with a company called Pearl Health. They give us access to the program. We wouldn't have access to the ACO REACH program at this date if we weren't partnering with an enablement firm that had already engaged in it. And they call them signals for patient level identification. So they surface patients that could benefit from particular clinical interventions. They have a system that we have dashboard managers in. We're trying to bring the data from that to our own home system so that our clinical teams are not having to engage in that way. And the highlight here, we actually have an executive steering committee tonight, so you guys are hearing it first. We are currently hitting top tier performance. We have a value-based payment incentive program, and it's based on essentially our performance to the most urgent of the signals. And we just got our May data back, and we're green all the way. So we're really proud of the work effort that's been going on here. It's a great new opportunity in a new space for AHP. And we've really had a lot of buy-in from across the network. So very, very exciting stuff. Any questions about that? Okay, thanks, Selena.
All right. Thank you, Elizabeth and Bob. Just another reminder, if you have not done so, please just add your name and your practice location in the chat. Next, we are going to turn it over to Dr. LJ Shipley to provide an update on the SCN work. And I'm going to stop sharing and you are going to share, correct, LJ?
I am. I just
Okay.
about sent you a request, but when you stop sharing, I will jump on. Thank you so much for that. Hi, everybody. Give me 1 second. This jumps around. Great. So I'm excited just to give you the very briefest update around the SCN work. And I want to just highlight here, you'll hear it at the end of the presentation too. But we're looking forward to hosting a meeting next week that would engage the practice champions or the implementation team doing the SCN work in each of your practices. I think often it is one of you, it is often the practice manager or practice administrator, but it gives us a chance to pull in the pediatric PCP advisory work group as well. So, but this is just highlights. So I just want to remind everybody, you know what bucket you fall into, but our partnership around the social care network with FLIPA as our regional SCN is really to facilitate the connection and support the screening and the engagement that needs to happen from our practices. And some of you have said you've got it, you do not need us, you're option one. We're interested to hear your best practices and how things are going, but we're leaving you to your own devices. And appreciate the work that you're doing in this space. Option two is where we have shared responsibility, where a few of our practices are conducting the patient screenings utilizing the Accountable Health Communities or AHC screening tool. But then we can take a warm handoff and provide the next steps that are required for the SCN work, the eligibility and navigation, and then care management for those patients who are eligible under the waiver to get health-related social needs connected and paid for by Medicaid. And then option three is where folks have said, take it, do it, and we're really doing all three components, including the initial screening. But it's been really important to us that that not be just a process that's siloed away from your practice, but a way that we can engage and communicate because, in all honesty, these needs are just I don't even have a word for it, that they're exploding right now, as you are well aware with some of the new federal requirements and legislation. We know that June 1st was a key time for many people who found they were now losing certain Medicaid and SNAP benefits. It's just going to increase into next year. So whatever work we do in this space, we need to do it together. So here's our updates. we were able, through a contract with FLIPA, to hire 3 new community health workers who were hired in March of this year. I don't have the hello slide, but you'll see a hello slide from me when we do the update next week. I loved that slide, Selena. But Flora Noya, Crystal Salters, and LaShawn Soto Rivera are 3 highly experienced community health workers. They've had years of time working within our communities, working with families at different agencies and providing community health work. And they were willing to join us and step in this work. It's different work because a lot of this is linked to the data platform and some of the workflows that New York State has required in this space. It's different, but it's beautiful that they're bringing this significant expertise and lived experience, and they're functioning as a team, and they connect with our care managers as well within AHP, our social work care managers. And it's really been awesome to bring them on board. It's an honor to work with them. They are fully trained and quite skilled on the FLIPA Find Help platform. They already knew many resources within the community, and they have become very familiar with others, particularly for our regions, our Finger Lakes region, and beyond. And we are currently adding more practices to their listing. So some of you have already been working with them, and others of you have not been introduced yet. So introductions are starting this week. You'll get an email notification this week as to who your community health worker is that'll be working with your practice. We will request to schedule a brief Zoom meeting, an intro. It doesn't have to be with your whole practice. What's worked really nicely is to have it be with the practice administrator, and then if there's another, SCN champion or team within your group. But it makes a big difference, even if we're not meeting in person, to see a face, to be acquainted with the individual. And in that time, we'll provide to you a brief script intro for your patients and for your staff teams so that they know about this work. We want to, as much as possible, allow practices to notify their patients of anticipated outreach. I shared with you all before in various updates, when it's a cold call, it doesn't go as well because most people don't want to answer their phone anyway. And then if they hear somebody's calling about specific information, even if they're able to identify as working with your practice, it's not quite the same. So when it can be a more facilitated, anticipated call or a warm handoff, it's so, so much better. And then the other thing we'll work with you all is to establish a workflow for provider attestation. So for those of you who don't know what that is, as Flora and Crystal and LaShawn and other members of our care management team go through this process of screening a patient, having them in the Find Help platform, and doing this eligibility and navigation, sometimes there's still a requirement for a letter of provider attestation from the PCP, basically stating this person does come to this practice, this person does have the identified medical condition or other condition that would allow them to qualify for these services. And that has been a sticking point, we've realized. When we're right in the midst of being able to connect someone to services, having timely turnaround on the provider attestation makes a big difference. And then, of course, the last piece is ongoing communication with your team. We want to make sure that you can get to us, you can get to the community health worker, and that also you are hearing what's happening for your patients. And we are currently in the process right now of working through a more comprehensive summary for the practices that will hit the mark for your PCMH attestation needs. If you're doing PCMH recertification, we know the SCN work is an important component of that. I don't have a model to show you yet because we're just working through a couple of things. We want to make sure that what we provide means you've got it. You don't have to go back and looking for things. We'll make it as seamless as possible. So the last thing I really want to tell you about is the priority populations. We feel like the most important thing we can do is have a workflow for urgent need. So if someone shows up in your practice, and honestly, this is whether you're already connected and doing your own screening or whether you are, asking us to do the whole thing. Someone shows up and they are about to be evicted. Someone shows up and finds that they have an acute need for food or for transportation that's other than medical appointments. I think it's really housing and food are the key ones that are urgent needs. We want you to be able to reach out to us, reach out to the community health worker straight away and say, I have a family that needs to be screened. I have a family that needs the eligibility navigation straight away because this need is urgent. And so we will make sure you have that information as we meet with you in the next week so we can provide that. That is a space that is working well in this right now. I will say to you that one of the really tricky parts of the SEN work is making sure there is the next team to receive the patient, passing the patient, the family, the football down the field. The community resources are getting saturated, but there are workflows for, imminent eviction. There are workflows for my power's being turned off tomorrow or the next day. There are workflows for I have no food at all, for my family. And so we have to be responsive to those, and we continue to work closely with FLIPA and with our community to try to enhance access to other services, but the need is far outweighing the resources right now. We've identified two other priority populations. This isn't new to any of you, but postpartum and pregnant individuals automatically qualify. So we feel like that doesn't need a provider attestation, and postpartum qualifies for the first year after birth of a baby. And so we want to make sure we're getting to those people. So we will talk with your practice about workflows for pregnant individuals and families, and specifically for peds practices where you're caring for the baby, but you do care for the family, but they're not your patient. We can look at a listing of practice patients for babies less than 10 months of age. It's a nice way to identify a postpartum family, even if that baby doesn't have a qualifying condition. Food for the family, for the postpartum mom, will help with that, the entire family. And then the other practice group, or the population group, excuse me, is pediatric patients with uncontrolled asthma. We've been able to do some lists through Health Catalyst to be able to support that screening, and we'll continue to do so. But that's another population that has now, at this time, active as of 2 weeks ago, a nice referral plan where our community health workers can pass off to the asthma experts, the asthma home assessment experts, who then can pass on to services for home remediation for those patients who have either, need something in the home, whether it's anything from a HEPA filter to more imminently, having mold in the home, having pests in the home that are contributing to asthma. So there's good movement in these places. It's slow, but we can't do everything. You all can't do everything, but we need to do our part. We need to be able to be responsive and be with people, and even just, being with them. That's one of the things I'm learning from these CHWs, is sometimes that resource is not available. And our AHP care management team always does the same. Sometimes the resource isn't available in the moment, but if you stay engaged with that family and with that patient, that makes a difference. Not being alone in the face of this is important. So I think it's really critical work. It is work of the heart without question, and it impacts health critically. So, Zoom meeting next week, we're re-upping the invite. The invite did go out early to the pediatric advisory group that meets with AHP. Your SEN practice champions, you all will get that invite later today to make sure it's on your calendars. And we'll have our community health workers team available on that call too, for if there are any questions. And then if you have any questions, we all just like putting Kevin Kelly on a slide when he doesn't know it, but Kevin is really the person on the team who is working most closely with me to help organize and lift this work. I'm grateful for him. So you can email either Kevin or me if there are questions. I'm happy to entertain any questions as well. Okay.
All right.
Okay,
Yes.
sorry, there was a little of a delay here.
Oh.
This is Sabrina. I have a quick question for you. Is there any
Yes.
work being done outside of Monroe County, or is this solely in Monroe County?
Oh no, this is throughout the entire region. So our scope with AHP, I'm gonna list the wrong number of counties, I'm sure, if I do, but But we are working within, the entire Finger Lakes region down to the Pennsylvania border over towards our colleagues in Corning. So no, it's very comprehensive.
Thank you.
You're welcome, Sabrina. Thank you.
Any other questions? All right. Thank you so much, LJ.
Yep.
Okay, so we are going to move on to our open discussion. Everyone see the screen okay? Transferred over all right? Perfect. Okay, so we did have a request from one of our practices, hoping to get some input from others on this call. What vendors are you using to maintain oxygen tanks in your office for nebulizers?
We've got someone in the chat who said Quinlan's Medical Supply, another saying Neb Doc. Are folks using Everything Medical? And you can come off mute and talk, and if there's any benefit to one vendor over another, we're not going to subjugate you to silence here. So Quinlan's Respiratory Services of Western New York. So Quinlan seems to be giving quite a bit of support to practices.
All right, thank you for those responses. Are there any other questions or topics of discussion that anyone would like to bring to the greater group? All right, I'm not hearing any, so we are going to keep the meeting rolling. So just a reminder for provider contract timelines, essentially just let us know. Let us know when someone is leaving the practice, information about when their last day is and where they may be planning to go. If they're switching to a new practice or retiring, all of that information is helpful for us to have. And let us know as soon as you know that information. Also, for any new providers that are joining your practice, we like to know about all new physicians and primary care APPs joining your practice. It helps us just keep all of our information up to date, our provider directory up to date, and to make sure that we can get people enrolled so that you can receive enrollment in these value-based contracts that we do have. You've all seen this slide before. This is our inclusion cutoff dates. You see the little arrow. We are here currently through the May 15th through October 14th window. Anyone enrolling now to October 14th would be eligible for participation in all contracts in January of 27. So again, just a reminder, just let us know if people are joining or leaving the practice. So our upcoming practice manager meeting schedule, next meeting is going to be September 9th. And then December 9th after that. We do send several reminders and invitations. And if you think someone else is not getting those invitations or reminders, certainly reach out. We can add them to that list to make sure that they're invited to those meetings to get this information. Again, we always like to review this that yes, we are an AHP participating provider. So that means for your patients, you refer to AHP specialists as often as possible. You admit patients to AHP hospitals when you can, and send patients to AHP imaging and labs whenever possible. For your practice, you're going to monitor that the PER, which Elizabeth gave you a little snapshot of what that looks like for your performance. Come to these meetings. These meetings are for you. We always want to be providing meaningful information. So come, and if there are topics that you'd like to hear more about, reach out and let us know. Accept, read, and share AHP communications. A hot tip, there will be a Pharmacy Pearl coming along soon. Within the next couple of days, you'll be getting that. That's a well-received piece of information and our network news. And then just help other providers connect with AHP resources. We always like to share some of our contacts here at AHP, your provider relations team. Obviously, Jana and I, at the time being, when Molly returns, you can feel free to reach out to her too. Our optimization team, Elizabeth, and there's Kevin again. And then behavioral health and our pharmacy teams. Always happy to answer questions. And then just some of our partner programs, RMS Healthcare, Medline, and Atlantic Health Partners. So with that, thank you so much for attending. Anyone have any last thoughts or questions they'd like to share before we sign off? Anyone? All right, with that, have a wonderful summer. We will see you in September. Thank you everyone for coming. Have a good day.